would like to call upon Dr. Munidhar Sharma sir, STMC ODP, to take over the session. Welcome to you, sir.
Okay. Unfortunately, in the last session, I had made a mistake. I had skipped that third chapter of shuklagata roga vijnaniya, and I skipped to the krishnagata roga. It was an inadvertent error, and with due apologies to Sushuta, let us again continue with the same. The अथाथ शुक्लगत रोग विज्ञानीयम् अध्यायं व्याख्यास्यामः. प्रस्तारे शुक्ल क्षत्राधिमांस स्नायु अर्म संज्ञाः खलु पञ्चरोगाः स्युः शुक्तिकाः स अर्जुनपिष्टकौ च जालं शिराणां पिडकाश्च याः स्युः रोगाः बलासगृत्तितेन सार्धम् एकादशाक्ष्णोः खलु शुक्लभागे. The lesions which occur in the shukla bhaga, that's in the scleral area, that white component, are the 5 types of the marma, and the shuktika, arjuna, pishtaka or pishtajala, sirajala, and balasagrachita, these are the 11 disorders. Now, the arma as such is a specific disease entity, and then you have the different categories like prastari and so on. Now, prastari arma is prastari pratikramiham arma shukla bhage vistirnam tanu rujira prabhum sanilam. A widespread, relatively wider but thinner a lesion which has some reddish color or occasionally bluish color is called as a arma. In the current situation, we call that condition as a pterygium. Pterygium is a very common issue. It occurs quite frequently. It's defined as an elevated superficial external ocular mass that usually forms over the perilimbal conjunctiva, over the external surface, that's lateral part, more frequently, and extends onto the corneal surface. See, as long as it is limited to only to the sclera, it doesn't affect anything, like it's usually asymptomatic, it doesn't produce any symptom except that it produces a visual impairment of look only. When you look at the eyes, you may feel that reddish there. But if it extends into the corneal level, that crosses that white matter, then it may affect the vision, block the vision as such. The pathology is a degenerative pathology where the elastic component of the sclera has been degenerated and collagen is replaced by a fibrovascular proliferation, and over there would be a layer of epithelium. The causes which are known are increased exposure to ultraviolet light, like living in subtropical or tropical climates. Those who in India, which are supposed to be due to the exposure to the sunlight and dust, that the pterygium incidence is quite high. In India, pterygium incidence is quite high. But again, the issue is they develop the symptoms only it extends into the corneal area. Otherwise, most of the patients will have that pterygium without any symptoms as such. And engaging in the occupation that require outdoor activities also enhances that. A genetic predisposition to the development of pterygia also is known to be there in certain families. So now pterygium is classified in different manners. The very common, the popular classification among the ophthalmologist practice is the stage practices, like where Johnston's pterygium classification, either where it is a pinguiculum, when it is relatively thin and posterior to the limbus, or tissue involvement of the limbus, where the lateral component of the lateral angle of the eye is involved and that tissue is involved, then that's called the stage 1. And if it is slightly thicker and it's just on the limbus, you can see that as a raised surface, that's called stage 2. And the limbus and the pupillary margin, if it is a wider area, then it's called as stage 3. And if it reaches to the central to the pupillary margin, towards the cornea, then it's called as stage 4. Or the other way, the classification is the TANS classification. It's based upon either atrophic changes, intermediate changes, or fleshy changes. Like the episcleral blood vessels are just beneath the pterygium are visible, and when the episcleral blood vessels are partially visible beneath the body of pterygium, or episcleral blood vessels are not really seen at that. It has become somewhat opaque. So these are the methods of classification of the pterygium as such. Now all this importance of the classification is when you go into the description of the different varieties of the marma. The prastari marma is the one where it's limited to the shukla bhaga, and but tanu, it's thin as such, something like the first stage as such. The different stages of the pterygium as you see in the patients would be the first degree, of course, it's very thin, the times first classification stage. The stage 2, of course, it's a normal 0. The stage 1 is when you just see these very thin layers, and you will be able to see that only when the eye is rotated to the medial side. And stage 2 is where you can see the mass, but the vessels are still visible, episcleral vessels are visible. The stage 3 is the episcleral vessels are masked by the pterygial mask, and the stage 4 is fleshy, where it is very thick and it is extending towards the cornea as such. Now all these are important because the classification of Arma, the different names given by Sushruta as Arma are the parts of the classification. When the same, the Shukla Arma is Shuklakhyam Mridu Kathayanti Shukla Bhage Sashvetam Samamya Vartate Chirena, a slow growing this pterygium which is having a relatively pale appearance and limited to only the Shukla Bhaga, only the sclera. That is considered as the Shukla Arma. So all these the different types of Prastara, Shukla, Kshatraja, Adhimamsa, the different types of the Arma mentioned by Sushruta are now considered as the different stages or the grades of the Arma, pterygium. Yanmamsam prachayam upaiti Shukla Bhage Pagbabham Tadupadishanti Lohitarma. When it is a fleshy mass which is seen over the Shukla Bhaga and looks like the lotus flower, that means the bright red or fleshy appearance, that's something like the grade 4 times grade 4. Such a lesion is called as a lohitarma. And Vistirnam Mridu Bahulam Ekrat Prakasham Shavam Tadhikamams Armam Odanti. Adhimams Arma or Mams Arma is when it is very wide and thick as such, and the color could be something like Ekrat Prakasham, again red, suggestive of the high vascularity, and that fleshy, very thick appearance is called as the Mamsarma. So, Adhimamsarma as such. Then Shukla yat Pishram Upaiti Vruddhim Etad Snagarma iti Abhipatidam Kharam Prapandu. When the same has become very hypertrophied and fibrosed, rough as such, the same when it becomes rough and it's very extensive, then called as the Snayavarma, where it has become rough as such, fibrosed. Now, all these names are simply a sort of a reflection of what's now considered as a grading, as different grading as such. Otherwise, they are the same lesion. Now, the present day situation, we consider all the pterygium as a single disease, and you consider this as a grades. Sushruta has named them as the 5 varieties of the different diseases. Now, the next is about the Shukti as such. Shavahasyu Vishanibhashta Bindu Ye Shuktyabahasitan Heneta Shukti Samnyaha. When you have a bluish or reddish dots over the eyes, and which looks like somewhat fleshy appearance or dots of fleshy appearance, Pishitanibaha Bindavaha, dots which are reddish or greyish in color, that's called, and which is mainly seen in the scleral area, that's called as a Shukti. Now that's exactly the feature which we see as in the congenital xerosis or xerophthalmia. The xerosis, congenital sclerosis or xerophthalmia is again a degenerative disease where there is the replacement of fibrous tissue from the collagen tissue without the proliferation. In pterygium there is a epithelial proliferation, whereas in the xerophthalmia there may not be a proliferation of the epithelial tissue. The fibrous surface is visible naked over the surface, and it is graded as an X1A, B, and the X2 or X3, so on. And of course, as far as the causes are concerned, the well-known cause is vitamin deficiency. Vitamin deficiency is supposed to be one of the causes. The other cause is a continuous mechanical irritation of the eyelids. It results in symptoms of irritation in the eyes and continuous discharges from the eyes because of the rough surface, and something like the dry eye phenomena could be the presentation. And because of the scarring, the vision may not be completely obstructed, but the patient may have a blurred vision or a smoky vision could occur in such conditions. And the clinical appearance, and of course, when there are more of spotty changes, there could be even pain also. This ophthalmia also can produce pain. And it's graded as X1A, where it's only a conjunctival xerosis, limited to that. X1B is when there are bite or spots, like spots seen over the area, as you see over here. Now, these are bite or spots seen, spots which are seeming to be rough and located in a scattered manner. And when the X3A is keratomelastia in less than 1/3 of the cornea, if it is in a smaller area, X3B is more than 1/3 of the cornea being involved, and X5 is cornea scarring, and XF is xerophthalmia of the fundus, where the spotted fundus and decreased amplitude of the electroretinogram. That's because of that the eyeball shape is altered, and you will see the deposition, thick deposition over the area. That condition is the xerophthalmia as such. Then comes the Arjuna. Arjuna, eko yaha shasha ruchira upamastu binduhu shuklastho bhavati tamarjunam vadanti. Now, Arjuna is a bright red spot seen in the eyes which doesn't produce much pain as such. Now, this is exactly what we see in case of the subconjunctival ecchymosis. It is a very common issue. It could be due to some minor trauma, like you may have a subconjunctival hemorrhage, or it also can occur in the patients who have systemic disorders of the bleeding, like there could be a reddish spot, and most of the times it tends to get resolved by itself without leaving any later evidences. Very rarely it may lead to a pigmentary spot. So a subconjunctival hemorrhage, subconjunctival ecchymosis, which are seen after a trauma, minor trauma, they are very common, and though they look like very reddish spots over the area, most of the times they would be asymptomatic and they will be self-resolving conditions, which are called as Arjuna as such. And if at all the patient has this evidence of the ecchymosis without a history of trauma, you need to investigate the patient for the possible bleeding disorders or clotting disorders, and many times you may get a clue there. Rarely in a patient of severe toxemia, ecchymosis can occur. There again, the toxemia is the basic issue which needs to have the attention. Ecchymosis would resolve by itself. Then comes the flictennular conjunctivitis, or this pishtaka. Pishtaka is utsannaha salilanibo ata pishtashuklah binduriyo bhavati sa pishtaka surutah, a circular swelling which looks like this heap of floors. Pishtashuklah looks like a nodule-like appearance, or it also may have a color like water, that's either transparent or yellowish color, which is having a raised surface. Utsannaha, raised surface. Pishtashuklah bindu, a bindu dot which is seen like that of a heap of any this floor like, it's called as a pishtaka. Now, exactly the same phenomena is seen in flictennular conjunctivitis. Flictennular conjunctivitis is mostly seen in patients with allergic sensitivity reactions, or it also can occur to the patients who have systemic disorders like tuberculosis or staphylococcus infections, herpes, chlamydia. In such conditions, it can occur, which is presented as a yellowish nodule. Usually, again, this also will be painless, asymptomatic, except that occasionally it may produce some conjunctival irritation, reddish discoloration around, but they are asymptomatic. They do not require a specific treatment, but only thing is, when you have the patients with these nodules, you will have to identify the cause for that. Either it could be allergy, or it could be due to the antigens in the body, which may require a treatment. So, it's not the primary ophthalmological conditions, but it's a evidence of ophthalmic evidence which can often reflect the systemic disorders, which need a separate treatment as such. So, flictennular conjunctivitis, the word meaning of flicten is yellowish nodule in English as such. Then the next is about sirajala. Jalabha katina sirah mahan saraktah santanah smrtayah jala samjitasto. The sirajala is a situation where there would be blood vessels which look like network like over the scleral area, and that condition is sirajala. That's exactly what you see is the in case of the scleritis. Scleritis is defined as inflammation in the episcleral and scleral tissues with injection, that's with this, that reddish discoloration, both superficial and deep episcleral cells. The difference between ecchymosis and scleritis is in ecchymosis there is only a spot of bleeding just below the conjunctiva. The scleral tissue, the deeper tissues of the sclera are not involved. But when it involves the deeper tissues, that is what we call as a scleritis, and it may involve the cornea and or episclera. When it involves the cornea and the uvea, then you will have the vision abnormalities. But scleritis limited only to the sclera may not produce the vision abnormality. The abnormality could be thus that there could be persistent discharges from the eyes, a sense of irritation in the eyes can occur. Beyond that, that may not be any symptoms. And it's often, almost every times, it's related to some systemic disorders. And with the rheumatoid arthritis is the most common. Patients of rheumatoid arthritis, more than 50% of the patient would have the scleritis quite commonly. And of course, the treatment there again would be targeted at the rheumatoid pathology than really about the scleritis. The only issue is when the scleritis reaches to the area of cornea, it may affect the vision. Then comes the Sisapidaka, Shuklasa Sirapidaka Sirapaya Asita Samipaja Sirajaha. The Sirajala, when it is very close to the Asita Bhaga, that's the cornea Bhaga, that's a Asita Pidaka, or which can affect the vision as such. It's almost a similar issue. Or it also can occur in the granulomatous iritis or inflammatory pathology of the uvea antiderivatives. It's also seen in autoimmune disorders like tuberculosis, rheumatoid arthritis, or herpes reactivation conditions. The clinical symptoms are often pain, photosensitivity, reduced visual activity as such. When you look at the eyes, you will see the dots over the cornea, the corneal dots. It's something like the flicted Miller pathology, but instead limiting only to the sclera, you will be seeing them in the corneal area, below the cornea. Corneal surface would be clear, and these kinds of the dots seen are very classical signs of granulomatous iritis, which again are consequences of the systemic disorders like tuberculosis, rheumatoid pathology. And in these conditions, again, the primary treatment would be to the same systemic disorder than the other way. Then, Kamsya Bhavati Sindho Sitaha Ambubindutulya Sajnyo Amruduh Arujaha Balasakakyaha. Balasaka is a painless and relatively firm swelling which is Kamsya, which looks which has a greyish color or reddish color, or Ambubindutulya, colorless. Either it's colorless or having such colors over the area, and painless condition. That's called as the balasaka. That's exactly what we see as the scleral nemus or pigmentation or something like the moles in the eye. Now, that scleral nemus often can be a birthmark. It can be considered like a birthmark and mostly asymptomatic. Rarely it may produce it may be considered as a precancerous, like melanoma. Rarely it can occur, very rarely. But blurring of the vision rarely occurs if at all it is involved in the cornea. But as long as it's in the sclera, it doesn't. The other issue is the cosmetic. Most of the people who have that spots in the eye, black spots in the eye, they are considered as bad women in the society, and people just move away from these people. It's a sort of notion which is existing in the people. Otherwise, it doesn't produce any harm. As in any other case of the nemus, like as in any other case of the moles, this would be asymptomatic. With this, we will conclude Shuklagata Roga Vijnaniya Adhyaya, 4th chapter, which we had missed in the last session. Then comes the sarvagata Roga, where we had started in the last session, but we will continue from the point where we had left. So in the last session, we had considered about the Abhishanda as such. These issues we have discussed, conjunctivitis or Abhishanda we have discussed as such. Then the next is about the adhimanta. We will continue from that point where we left over. Adhimanta is वृद्धेहि एतेहि अभिष्यन्देहि नराणां मक्रियावतां तावन्तस्तु अधिमन्ताः स्युः नयने तीव्रवेदनाः. Adhimanta are the complications of the abhishanta. A conjunctivitis, it may, if it is not treated properly, it can result in the complications, and that which can produce more severe pain and severe complications, that's called as adhimanta. Now the adhimanta are often again considered as a glaucoma in some majority of the Shalakya textbooks, and generally the Shalakya specialists would translate that adhimanta as a glaucoma. But actually, if you look at the clinical features mentioned in Sushruta, that's not the feature of glaucoma, rather it is a sign of endophthalmitis. So I would consider abhishanda as endophthalmitis, where the inflammation results in the deeper tissues of the eyes involved, particularly the anterior chamber of the eyes being involved. And again, it can be a complication of either conjunctivitis or any other infective pathology. Local infective pathology can result in the endophthalmitis. The glaucoma is usually painless condition, and its glaucoma can result in the loss of vision without any showing a symptom. It's a silent killer. Whereas the clinical symptoms of the adhimanta mentioned by Sushruta is उत्पाट्यते वाक्यर्थम नेत्रम निर्मथ्यते तथा शिरसो अर्थम च संविद्यात् अधिमंतम सुलक्षणैः. The major symptom is about the pain in case of the adhimanta according to Sushruta, and that's why I would not consider adhimanta as a glaucoma. Though in popular in Ayurvedic textbooks, Ayurvedic colleges, it's usually taught as adhimanta as an endophthalmitis. Endophthalmitis is also a very common complication of the ophthalmological surgery. Post-operative complications. One of the post-operative complications is the presence of that sepsis in the eyes. It is the endophthalmitis. It will be quite painful, and there will be a lot of discharges also, and it also can be a cause for the loss of vision in due course of time if it is not treated properly. And one of the rather terror to the ophthalmologist in the post-operative period if the sepsis occurs. It's something like, as you see, an abscess elsewhere. It's an abscess in the eye. And this endophthalmitis is again graded as a grade 0 to 4, depending upon whether the cornea is involved or not. If the cornea is clear, then it's called the grade 0. If the cornea has become opaque, then it's a grade 4. If there is an abscess, a real pus-like condition, if it is not seen, none. If the abscess is more than 5 millimeters, then it's grade 4. In between you have the others. Then the flash cells, like if you can see this hypopyon. Now hypopyon is the collection of the fluid. This sign, collection of the fluid, pus-like fluid in the anterior chamber is seen. Then it's again depending upon the degree. If it is not seen, 0. If whole of the area, iris is involved, the iris is not completely visible at all, whole of that is seen, then it is considered as grade 4. In between you have the marks like less than 25%, more than 25%, that's how it is graded. Presence of the exudates or the blood vessels in the area, again based upon that, if there are no inflammatory signs of the increase in blood vessels, 0. And when you have the whole pupil occluded by the new vessels there, then it is considered as a grade 4. Or if the opacities, vitreous opacities, that fluid has become opaque, then it's grade 4. If it is not, so this way the endophthalmitis is graded. Now exactly in the same manner, the adhimanta is categorized by Sushruta, but Sushruta has named them as these different consequences based upon doshas, Vataja, Pittaja, Kaphaja, Raktaja, and so on. Now in case of the Vataja adhimanta, the pain is a major symptom. Netram utpatiteva machyate aranyavachayata. Sangharsha toda nirbheda mamsa samrabdham abilam. Kunjana aspotana adhana vepatu vyathane shiraso ardham chayeni syat adimantaha martha. The more severe pain, and the patient may have a grayish appearance over the sclera. The whole area becomes greyish in the appearance. That's considered as the Vataja. It could be something like the higher grade of the endophthalmitis. Then Raktaradichitam Sravi Vanina Iva Avadashyate, Yakut Pindopum Dahi Ksharena Aktam Iva Kshatam, Prapako Uchuna Vatmantam Samsedam Pitadarshanam, Murcha Shirodahitam Pitena Akshay Adhimantam. The Pittaja Adhimanta or endophthalmitis with some better grade, may not be exactly the same type of grades which we see, but where the signs of inflammation are more conspicuous, vascular changes are more conspicuous, they are considered as the Pittaja Adhimanta. So where the patient would have Raktaradichitam, where there would be reddish color and more discharges, and the patient may have the systemic signs of the inflammation like fever, etc. The vision also may become yellowish color. Murcha Shirodaham, there could be even systemic signs of toxemia can occur. That's considered as the Pitta-Jadhimanta. Then Kapha-Jadhimanta is Shokavatu Natisamrabdam Sravakandusamanvidam Shaitya Gaurava Paichilya Dushika Harshananidam Rupam Pashati Dukhena Pamshapurnamivaviram Nasadhana Shirodukhitam Shleshmadhimantidam. In the Kapha-Jadhimanta, the patient would have a nasardhana, that because of the excess of tear discharges, that tear discharges may be flowing through the nose, and hence the patient may have nasal discharges, and comparatively it will be less painful, but it affects the vision. The vision would be quite affected. That's seen exactly in hypopion. Hypopion, when the pus has become collected, the systemic signs of toxemia would be reduced, but the pus present in the corneal or limbus area, anterior chamber, may be filled with the pus. The vision would be significantly affected because it produces opacity. That's exactly the Kapha-Jadhimanta. So exactly the same conditions can be seen in the present day situation. The only difference is now they are considered as different grades of the endophthalmitis. So should have considered them as the different categories of the Adhimanta. That's all the difference. Now in case of Rakta-Jadhimanta, Bandhujiva Pratikasham Tamiti Sparshana Akshamam Raktasravam Sanistodam Pashyati Agni Nibhaha Dishaha Raktam Agnarishtavatja Raktam Agna Arishtavatja Krishna Bhagashta Lakshare Yadiptam Raktapayam Tadraktena Adhimantidam. Rakta-Jadhimanta would have a hemorrhagic changes. The whole eye may looks like a reddish flower, Bandhujiva flower, but this is something like Langari flower, where bright red color may be seen in case of the eyes. Eyes may look like a flower as such, and the whole, even the cornea may become reddish in color. So hemorrhagic changes are seen in such conditions. That's considered as a Rakta-Jadhimanta. That's about the different varieties of the Adhimanta mentioned by Sushruta. And I would consider Adhimanta as endophthalmitis and really the glaucoma. The complications of the Adhimanta are Hanya Drustim Sattaraprat, Kafokto Adhimanto Asruk Sambhava Panjaratrat, Shadratrat Vai Martotha, Nihanyat Mithyatarat Paitikas Deva. The vision would be affected due to the Adhimanta, that endophthalmitis can harm the vision. But duration, time taken for the vision would be, in case of the Pittaja, because of the acute inflammation, there could be immediate vision loss, whereas in case of Vataja, it may take about 6 days, whereas in Kaphaja, it may take about 7 days for the vision loss. That may be, or in case of the Raktaja, it could be within 5 days that the vision may be lost. So the time taken, it's all suggestive of the course of the disease. Course of the disease is more rapid in Pittaja and comparatively slower in case of Kaphaja as such. Then the next is the Netrapaka. Netrapaka is Paka as such is suggestive of a pus formation. Kandupadeha Ashruja Pakwa Udumbara Sannibha Daha Samharsha Tamratva Shofa Nistoda Gauravehi Justo Muhu Sravecha Asram Ushna Shitam Pichilam Sambrambhi Pachete Yashta Netrapaka Sashofajaha. Netrapaka is that condition where there could be a suppuration, pus formation, and there will be wide spread clinical symptoms of burning sensation, reddish discoloration, swelling, and the whole eye may look like Pakwa Udumbara, the ripened fruit of the Udumbara plant as such. So whole reddish ball-like appearance could be seen, and there will be lot of discharges. That's exactly what we call as a panophthalmitis. Panophthalmitis again is either a complication of trauma, like again postoperative. Endophthalmitis is limited to the vitreous, that the inflammations. In panophthalmitis, the whole eyeball structure has become inflamed and the pus may be collected in the orbital space also, and it results in the phthisis or eyeball become fibrous later on in due course of time. The whole eyeball would be lost. So it's not that one component of the eye would be involved. That's the panophthalmitis, very serious condition, and invariably the patient would be losing the vision. It could be due to the trauma either as post-operative or accidental trauma that panophthalmitis occurs commonly. Then the thesis, the Shofahina Lingani Netrapaka to Ashophaja Netrapaka, that's the later complication, as I said about one of the major ending or termination of the end of this panophthalmitis is, so what if the panophthalmitis is either treated by surgical treatment of either the whole eyeball may be removed or maybe at times it could be a drainage, or even otherwise if it is recovering, the patient will have a fibrosis and the whole eyeball will be shrunken and functional, non-functional, it will lose the function, and that's what we call as a phthisis bulbae, where the whole eyeball will be shrunken. Shopahina Lingani, all the other symptoms of the panophthalmitis and the shopa would be absent, it becomes shrunken. That's the Ashophaja Netrapaka or phthisis bulbae. In these conditions, phthisis bulbae conditions, there is no question of any other recovery. The only thing is for cosmetic purposes, you may have to replace that eyeball, remove the eyeball and keep some prosthesis over there. Then comes the Hatajimantaha. Hatajimantaha is a condition where it can be a complication of the Adhimantha. The endophthalmitis or such conditions, when they are neglected, it can result in a long-term complication, and that's called as Hatajimantaha. Upekshana Akshiyada Adhimanto Vatatmaka Sadayati Prasahya Rujabihi Ugrabihi Asadyesha Hatajimantak Khalunama Rogaha. I would consider as a Hatadimanta as the glaucoma, because it's a long time process, very chronic process. After any of the primary diseases are not treated properly, and it becomes asadhya, incurable, and it results in very serious complication of the eye loss. Now, glaucoma is one of such silent killer. It always remains a silent, asymptomatic till very late stages when the patient would have the vision loss. Rarely it may present with the symptoms like headache. Glaucoma is a condition where the drainage of the vitreous is affected, resulting in a build-up of the pressure either in the anterior chamber or in the posterior chamber, or it could be in both the chambers, that the glaucoma can result in a build-up of the pressure, and the normal intraocular pressure is around 10 to 21 millimeters of mercury, and most cases of glaucoma would have more than 20 millimeters of mercury. Rarely you may have the patients who have the glaucoma complications even at the range of 12 to 21 millimeters of mercury. The pressure in the eyeball is measured by tonometer, or now you have more sophisticated instruments where with the tonometer you have to keep that instrument in close in touch with the conjunctiva, which produces more irritation and the risk of transmission of the sepsis, etc. Now you have more sophisticated instruments where the tone can be assessed by a blow of air in the machine, in the instrument, and that can measure the intraocular pressure instantaneously, accurately as such. Now, that variation in the pressure would be resulting in damage to the retinal electron, and that retinal damage can result in the eye pathology. Now, glaucoma is classified in the oldest classification which we have studied in the early years like 80s. It was classified as based upon the etiology as primary or secondary, or it is also based upon the glaucoma produced due to anterior chamber anatomy like open angle and closed angle. So that's classification of open angle and closed angle now is not presented in the current textbooks. In the current textbooks, the classification is based upon primary open angle glaucoma or primary congenital glaucoma or primary closed angle glaucoma. That's the classification now. Earlier it was a sort of different classification, of course not much of an issue, and it's also classified based upon the onset of the disease like infantile or juvenile or adult onset, or again congenital or acquired. In the current classification, the primary classification is under the three categories: primary open angle or primary congenital or primary closed angle pathologies. Now that angle, closed angle and open angle, what I mean by that is normally the fluid would be circulated in the angle over area in between that ciliary body, at the ciliary body angle. So in the normal situation there would be a circulation as such. If the circulation is blocked due to any factors, like either it could be adhesions, fibrosis and so on, many times many other factors, the ciliary body and the canal of Schlemm, that canal through which the fluid has to be exchanged, if it gets blocked, there would be a build-up of the pressure in the either the anterior chamber or posterior chamber, that results in the vision loss. Now that's about the glaucoma in brief, and one of the more serious conditions in the current medical practice. Then there comes the next of the condition is a hatadimanta. The hatadimanta, I would consider this as again one of the varieties of the hatadimanta mentioned by Sushila is antaschiranam shwasanasthito drishtim pratikshipan hatadimantam janayatam asadhyam vidurbudaha. Hatadimanta is a situation where the sira, the blood vessels within the eye, they are affected, and which affects the vision. That's exactly what as the retinal hypoxia of the retinal structure. That's considered as hatadimantam, one of the varieties of the hatadimanta mentioned by Sushrita, Siraja hatadimanta. And there the pathology would be the patient would have a vision loss. The same vision loss, retinal hypoxia, also can be a complication of the glaucoma, or it can occur due to central retinal artery occlusion, ischemic pathologies like thrombosis, complication of diabetic eye diseases, and glaucoma. The same, the one which is mentioned by Sushila as a general adimanta, can result in hatadimanta or retinal hypoxia. Diabetic retinopathy can result in the same. So causes are same, and ultimately it results in the vision loss, because the retina would be having the vision bleeding issues. The typical hypoxic changes in the retina, they are graded as you look at the fundoscopy. The normal fundoscopy, you will have a bright reddish hue. In the early stages of the hypoxia, there may be a pallor, and the vessels may be looking normal. The next stage, the vessels become coppery, vessels become hypertrophied and thicker, and that's what we call as the coppery vessels, look like coppery. And then there could be a proliferation of vessels, number of vessels could be more, or there could be hemorrhagic spots, the spots are there, or at times the whole retina may become detached, the whole becomes avascular. That could be the complications of the retinal hypoxia. And the retinal hypoxia now is better diagnosed with the immunofluorescence study than really the fundoscopy. With the fundoscopy, there is a chance of missing. So immunofluorescence study is now considered as a standard benchmark to study the retinal hypoxia. And in the patients of diabetes mellitus having the vision abnormality, now the standard protocol is to have a immunofluorescence study which can identify the hypoxia at early stage, and that can be managed. Anyway, that's about the hatadimanta as such. The next type of the condition is a vata viparyaya. Now that's pakshmadvaya akshibhromashirastu yatra anilah sancharati pradushtah paryayashaschapi rujak karoti tam vata paryayam udaharanti. That a pain which is produced in the area resulting in the abnormality of the movement of the palpebrae. The palpebral movements would be affected, and there would be severe pain, acute pain. That's quite common in case of what we call as optic neuritis, a variation of the neuralgia, trigeminal neuralgia, and these are almost similar issues, but it's not only the trigeminal, it's about the optic nerve which becomes demyelinated. Now that optic neuritis can present in multiple sclerosis commonly, and the fundus this investigation. Now same optic neuritis type of the lesion also is later on mentioned in the Dristigata Vyadhi. In the Dristigata Vyadhi, Sushita refers to the same issue, but in that condition the movements of the eyebrows may not be affected, whereas in the one of the categories of the optic neuritis, which involves the trigeminal nerve also, the movements of the eyeball could be affected, and the confirmation would be by either the fundal color photography, which can show the disc edema, or it can be seen by the fluorescein angiography, which is also the standard protocol, where the vessels can show the leakages, or now MRI scan also is the other way of making the diagnosis of optic neuritis. Then comes the akshiprakopa, shushkakshipaka. Shushkakshipaka is an again very common condition which you see, where the patient would have yet kunitam daruna rukshavartma vilokane cha avila darshanam yat sudaranam yat pratibodhane cha shushkakshipakophatam dadakshi. A patient who would have a severe discomfort in the eye after getting up from the bed at the early morning because of the secretions getting concreted or hardened there, or where the patient may have a thick discharge. Kunitam is a hard mass coming through the eyes, and it may even result in the inflammation of the Vartman, the conjunctival surface and palpebral surface, and it also can result in a smoky vision. The vision may be affected. That condition is called as the shushkakshipaka. That's exactly, absolutely the same as you see in case of what we call as a dry eye syndrome or keratoconjunctivitis sicca. Now, that dry eye syndrome or keratoconjunctivitis sicca now is categorized as aqueous diffusion dry eye or evaporative dry eye disease. That's ADDA, and these are the two classifications. Aqueous diffusion is where the formation of the tears, lacrimal secretion itself is lesser. Evaporative is it gets dry due to some exposure or other factor. So for the evaporative dry eye disease, the management is simple. You cover the eye with some wet cloths and so on, so that evaporation is reduced. But aqueous deficiency dry eye conditions are difficult to be treated. Most of the times it's non-treatable. So that's how it has to be differentiated. Of course, the technique of differentiating that is a very detailed issue, which I will not go into that part now. You can think of that maybe later on when we discuss the chikitsa. Then the causes for the dry eye could be, the symptoms of the dry eye could be, patients may present with a symptom something like a foreign body in the eye, burning, itching and so on, or hyperemia may be seen. There could be thick mucoid discharge, that's what Sushruta considers as kunita, and there could be irritation of the eyeball region also. Excess of tearing occasionally common due to secondary secretion. It also can be dry eye may present with excess of tearing also. Photophobia and blurry vision may have the features like. Then comes the anyata vata. Anyata vata is exactly the trigeminal neuralgia. The vata viparya and anyata vata, there are some similarities. The difference is in case of vata viparya, the drishti, the affected vision would be affected, whereas in the anyata vata, the patient would have yasya avatu karna shiro hanustaha manyagato vapi anilo anyato va kuryadrujo atibhruvi lochanecha tamanyato vatam udaharanti. A pain in the whole facial area, avatu, that mandibular area, ears or in the forehead, as well as occasionally to the neck. That's exactly what we see in case of the trigeminal neuralgia. So anyato vata is a correct description of the trigeminal neuralgia. Trigeminal neuralgia and its causes and so on, we have already discussed in the neurology classes, which is already covered. So we'll just leave it as such, and it's one of the common complicated conditions which we see as such. Then comes the amladhyushita. Amladhyushita is अम्लेन भुक्तेन विदाहिना च संच्छाद्यते सर्वत एव नेत्रं शोफान्वितं लोहितकैः सनीलैः तादृक् अम्लाब्धिषितं वदन्ति. Amlabdhishita is obviously due to a dietary deficiency, that because the person consumes amlabhukta, a amlabhukta where sour taste is more common or more content. I would generalize it as a bilahi ahara in general, which doesn't produce sufficient nutrition to the body. It results in a eye disorder where the eyes may become swollen or reddish, or maybe there could be discoloration, pigmentation in spots over the area, which we now call as Bitor's spots. That's the typical feature of amlabdhishita. Now that's exactly what we see in case of the vitamin A deficiency. And vitamin A deficiency as graded by WHO, it starts with night blindness, then extent, then conjunctival cirrhosis, where there would be reddish or thick and rough conjunctiva, Bitor's spots. Now these conjunctival cirrhosis and Bitor's spots, from Srishtiva's point of view, they are categorized as separate disease entities. Then it can result in the corneal cirrhosis or corneal ulcers, which will be painful, and corneal scarring. Now, these later three stages of the vitamin D deficiency, vitamin A deficiency, they are considered as the amladhyushita, whereas the earlier stages they may be considered as the complications of adhimanta mentioned in Sushruta or Pistaka. In the Pistaka Vyadi, these are the conditions which are mentioned in the Pistaka, whereas the others are the same. So that's the only difference, but the clinical presentations of vitamin A deficiency are very clearly mentioned in Sushruta as such. Now, what you see that grading appearances like the congenital cirrhosis and Bayard spots. Now, majority of the patients whom we see in the clinical practice either come in the stage of Bayard spots or corneal sclerosis. A corneal scarring would be completely, the vision would be lost as such. Corneal ulcers, they may not be seen in the naked eye so easily. Most of the times a corneal ulcer can be better diagnosed only with the split lamp examination. So in the routine general clinical practice, the interest would be Bayard spots and the corneal cirrhosis. The others, for the corneal ulcers, a general practitioner cannot identify most of the times. Rarely you may, in a very huge ulcer it may be seen. Otherwise, you need a split lamp examination. And corneal scarring, of course, it presents with the opacity, where again only the history can help you to make out the condition. Then comes the Sirotpata. Sirotpata, avedana vapi sabedana va, yasya akshidadyahi bhavanti stamraha, muhu viratyanti taha samantad vyadhi Sirotpata iti pradishtaha. Sirotpata is either painful or painless, and it presents with the reddish discoloration, hyperemia in the eyes, which can be partially involving or the whole of the eyeball would be involved, and that's exactly what we see named as a hypema. Hypema is a presence of blood with the aqueous, a vitreous hemorrhage, particularly anterior chamber. If there is a hemorrhage, causes could be many, either it could be trauma or patients of hemorrhagic disorder, and that hypema is, though not very common, is one of the troublesome conditions where the patient may start with the initially small amount of the blood, reddish discoloration in the eyeball, corneal area, then it may just raise up, and it's graded into 4 grades based upon the extent as such. When it is less than 12%, grade 1, 12 to 30%, grade 2, above 30%, grade 4, 100% is grade 3, and 100% is grade 4. So this is how it is classified as such, and it's one of the most troublesome conditions which we see in the clinical practice. Though rare, it's not common. Then comes the Sira Praharsha. Sira Praharsha, Mohat Sirotpata Upekshitastu Jayeta Rogastu Sira Praharsha Tamracham Asram Sarvati Pragadam Tatha Nashaknoti Abhivikshituncha. It's actually a retinal hemorrhage or vitreous hemorrhage where the patient may have a bleeding. Mohat Sirotpata Upekshita. A Sirotpata which is not properly treated or it's neglected. Sirotpata is the same hypema. If it is not treated properly, or if it is neglected, or if it is not identified properly, it can result in Sira Praharsha, where there will be severe bleeding and the patient will be completely losing the vision. Now that's exactly either vitreous hemorrhage or even retinal hemorrhage could be considered. The Sirotpata, it could be made where you can see the blood spot anteriorly in the anterior chamber. Retinal hemorrhages, it may not be directly seen in the naked eye, only when you go for the examination you may see that. The fundoscopy may be showing that. So even we may consider Sira Praharsha as a part of that retinal hemorrhage also, or vitreous hemorrhage into the vitreous chamber, the posterior chamber also, with the same causes. Of course, retinal hemorrhages can present with the flame-shaped hemorrhages or splinters or disc-shaped hemorrhages, rock spots, vitreous hemorrhages where there will be extensive. So they are considered as grades as such. And pre-retinal hemorrhages where there could be a bleeding behind the retina and the whole retina may be detached, which may be quite troublesome. But these are again rare conditions and they require a detailed ophthalmological investigations. When a patient presents with that reddish discoloration in the eye, you need to go for the investigations, and with the investigations we may grade them as such. That's about the hemorrhages, retinal hemorrhages. Retinal hemorrhage is a very troublesome condition where the patient may lose the vision very rapidly, and it also can be presented as this emergency. And a patient presenting with hyphema, it needs to be, that patient needs to be thoroughly investigated, and early intervention is necessary in such conditions. With this, we'll conclude the sarvagata roga, and iti samidayam uttaradante sarvagata roga vijnaniya nama shashthodhyayah. If there are any questions, we'll try to answer and then wind up. Right, there are no questions, so we'll wind up today.